name is Juliana Vasilchuk, and I will be discussing the sad topic of infant mortality. Although the causes are many, I will be presenting to you a few of the reasons of why infants die, sometimes preventable and other times not. You will see the main thing to be the importance of knowledge and awareness. As you can see here, our infant mortality rate in the U.S. hasn't changed much. Although decreasing, it's at a slow rate. In fact, compared to other industrialized countries, the U.S. has the worst infant mortality rate. There just isn't much progress. And in much of the research I've found, lack of knowledge and awareness is the biggest factor in determining this rate. I have said that knowledge is the biggest factor in infant mortality. I can't stress that enough. Knowledge in the forms of proper prenatal care, such as abstaining from alcohol and smoking, to eating a proper diet, to education on proper infant care. Although knowledge is a very important thing, prenatal care is also vitally important, and in a country where many women lack access to comprehensive health care services, getting this information and care can be a difficult thing. An important aspect of knowledge is getting the right information. While researching this topic, I came about many articles that proved a link between vaccinations and an increase in infant mortality. Of course, after investigating these articles, long story short, I came to find that these were based on false information. The fact is, vaccinations prove to be a great benefit to infants and babies, preventing mortality. There is a big movement, however, to disregard these benefits. According to the National Institute of Health, sudden infant death syndrome, or SIDS, is the leading cause of death in infants between 1 month and 1 year of age, with the greatest risk being between 2 to 4 months of age. SIDS has also been classified as accidental suffocation. Over the years, SIDS has been on the decline, especially now with the understanding of what causes SIDS. Studies in New Zealand show that infants placed on their backs to sleep, avoiding bed sharing, using pacifiers while infants are sleeping, and lastly, this may seem like common sense, but never smoke near babies. This can also increase the chances of SIDS. Remember that SIDS can be preventable. The challenge is to find ways to apply our knowledge. Unfortunately, some countries show a high preference toward infant boys. This sometimes results in female infanticide. This preference has been associated with mainly Asian countries. The female's economic worth has been a great disadvantage to her in these countries, and it has been proposed that to promote gainful employment for women will improve the prospects of female infants. A huge gap in infant mortality exists between white and black babies. A most likely candidate to lose her baby would be a non-Hispanic black woman with a rate almost 2.5 times greater than a non-Hispanic white woman. In an article by Coleman, it was stated that when care recipients do not feel valued and respected, confidence in treatment and health care recommendations is decreased. In Madison, Wisconsin, the infant death rates for black women are the same as those for white women. There's no simple medical explanation for it and no medical model to follow. Although this town credits these results to heightened outreach to young women by healthcare workers and private groups. Dr. Schlenker, the county health director, states that pregnant women need to feel safe, cared for, and valued. I believe that when they don't, that contributes to premature birth and the fetal loss in the 6th or 7th month. Another interesting finding was the link between infant death and paternal involvement. The death rate nearly tripled for both white, black, and Hispanic babies when paternal involvement was low. Another aspect of infant death are the babies born in unsanitary conditions without proper care. Kits, which have been distributed by the United Nations Population Fund and other organizations, usually contain a plastic sheet, soap, towels, tape, gloves, a razor blade to cut the umbilical cord, and a pictorial instruction sheet. This can help prevent complications in an otherwise healthy baby. It's estimated that 3 million newborns die from preventable causes in developing countries. A new study suggests that lady health workers can make a difference in lives of newborns. These were women who had a 10th grade education and trained by the government an extra week. The outcomes were 21% fewer stillbirths and 15% fewer newborn deaths in the areas that were assigned to these women. Like HOMAT in the picture you see, these women provide basic health care, teaching simple newborn care practices, which significantly reduces newborn mortality and stillbirths. In an article by Tina Rosenberg, it describes places where doctors and nurses are scarce. Villages, such as desperately poor ones in India, are implementing programs such as Search, where ordinary women are recruited to take care of their village's health. These women also provide care and education to pregnant and new mothers, from weighing to monitoring vital signs to teaching about treatment for fever and diarrhea. Child abuse has taken countless lives of newborns and children. It comes in different forms, but the outcomes are the same. Baby shaken syndrome can occur from as little as 5 seconds and is usually seen in children younger than 2 years of age. What happens is that the brain bounces back and forth against the skull, causing swelling, pressure, and bleeding. This can cause permanent brain damage or death. According to the Kempe Foundation, it is estimated that in 2009, 1,770 children died at the hands of their abusers. More than 79% of these children were under 4 years old. In the United States, about 80% of all child abuse is perpetrated by parents. This is sad considering the ones these children trusted the most were the ones that caused them the most pain. There is hope, but only if we choose to become aware of what's going on in our world and then act on our knowledge. Too many of our babies are dying in vain.